Hi everyone and welcome. My name is Dr. Mohiba Tareen and I'm the founder and medical director of Tareen Dermatology. We're so excited to have you here for our Skincare for Hair event featuring the power of KeraFactor plus laser technology to treat thinning hair. We have an engaging program planned and I encourage you to stay with us until the very end. We'll be hosting a live Q&A session where you can submit your questions through the questions tab and our team and I will answer them live. We also have an amazing giveaway that you won't want to miss. Prize winners will be notified by email. So let's get started. So there are so many biological factors that can contribute to thinning hair. I am a primordial example. I suffer from many types of hair loss. The most common type of hair loss is something called androgenetic alopecia, seen both in men and women. So that's where you get thinning of the frontal hairline. You can get some recession. For men, you can get kind of that bitemporal recession. I also suffer from something called telogen effluvium. I went through a stressful time a few months ago, and about 3 to 4 months later, after pregnancy, stress, etc., you can get a diffuse shed. There are many other types of hair loss, scarring hair loss, autoimmune hair loss, that's kind of beyond the scope of this, but there are so many factors and many people don't know that there are many different types of hair loss that can present at the same time. So your doctor really has to know the science behind it. So in terms of KeraFactor, I love it because it is growth. These are growth factors. KeraFactors are growth factors. So many times when people are getting PRP, platelet-rich plasma, you don't know if your blood is optimized. So you may not be getting the benefit of getting all those injections in your scalp. The nice thing with KeraFactor is that it is optimized in the laboratory, especially for those dying and thinning hair follicles, and it will turn them back on. So it's a great technology. It can be used in people who are sick, people going through chemo, people who don't have the best blood products. I really like it as a doctor and somebody who loves science. So laser plus stem cells equals magic, in my humble opinion. I am a KeraFactor user. It has helped my thinning hair substantially. I like using fractional ablative lasers with KeraFactor. That means that we're making tiny little holes in the skin that very quickly close, so you're not like you have big open holes in your scalp. But right away we apply the KeraFactor. It penetrates in because some of you know that the hair follicle is actually pretty deep in the skin. It's at the dermal fat junction. So you do need something or somebody to make that little hole for you so that the stem cells can get in. Although applying topical KeraFactor is beneficial at home, it is even more beneficial combined with fractional ablative laser technology. I personally think everyone is a good candidate for KeraFactor and laser. We are all just getting older, but we are hopefully living longer, so we are going to experience hair loss at some point in our life. So using a little bit of light laser, some good growth factors, you can just continue to live your best life, have good hair, and not recede. In terms of downtime, that's one of the favorite things about KeraFactor that I have for my patients. There's very little downtime. Sometimes I'll do my KeraFactor right in the beginning of the day and I'll work all through the rest. You really shouldn't wash your hair for about 24 hours after. You try not to get sweaty because it kind of washes away the stem cells. But other than that, there's very little downtime. You can go right to work after. You're not too red. In terms of when you see your results, everything with hair is delayed for 3 to 4 months because the follicle is so deep in the scalp. So you may get less shedding right away, but to actually truly see results, everyone, you gotta wait the 3 to 4 months with any of these technologies. So even young people can be diagnosed and face androgenetic alopecia, which is female or male pattern hair loss. Keralase is a great option for these individuals. When we get just a little bit of bitemporal recession, so that means the temples go back just a smidgy, and we get, not in this situation because we've done some treatments, but the part can widen a little bit. And the studies show that hair loss is increasing through society. So I think it's really important that once you start noticing hair loss, you get on top of it right away. So again, look out for this bitemporal recession and then a little bit of widening of the part. So if you have any of those, if you're a lady or a man or in between, Keralase is what's right for you. Thank you all so much for joining us tonight. We loved having you here. A quick reminder, giveaway winners will be notified by email and by phone if applicable. And please check your text right after this event. Reply to book your consultation, your appointment, and our team will follow up to get you scheduled. I'll be here for the next 15 to 20 minutes in the questions box, so feel free to drop in any last questions. Thanks again. We can't wait to help you start your hair restoration journey naturally and safely. Okay, can everyone hear me?
Yep, we can hear you.
Great.
You.
Okay, so
Good job. Yeah.
awesome, because sometimes you don't know if everyone's talking and everyone can hear you and you're just talking. So Keralase costs $7.25 per treatment. A package of 6 is $34.95. So you don't necessarily need to do it annually. For many of my patients, they're very happy if they do it, every few years or so, and then they do things in between, such as laser hair caps, topical or oral minoxidil. So Keralase is not something that you have to do all the time unless you are really battling hair loss. So there are some people that do it annually, but it's not the vast majority of people that do need to do it annually. Okay, another question we just got is, does Keralase help with hair loss related to the use of GLP-1 agonists? So Keralase is great for GLP agonist-induced hair loss. So GLP agonist-induced hair loss is multifactorial. So it's both a telogen effluvium, like a temporary shed because of that rapid weight loss and the protein and the iron and everything that's lost during that time. But often in us who are middle-aged and above, it unmasks what's called androgenetic alopecia, female and male pattern hair loss. So you're getting both the telogen effluvium from that rapid weight loss, but then it's unmasking that, and then it becomes a vicious cycle. So using the Keralase, using the growth factors to turn back on your hair follicles is key before you really go into just a total nosedive and it's very hard to get your hair back. So for my patients who are experiencing GLP-1 related hair loss, I do recommend Keralase, but I also recommend optimizing all your other factors. So don't lose more than 2 to 2.5 pounds of a week with your GLP. Also make sure you're getting at least 90 to 100 grams of protein. Sorry, I have to just skip this. And make sure that you are doing all the other nutrients that are important, such as oral vitamin D, making sure you're taking enough iron, making sure your thyroid function is correct, because sometimes when you are on GLPs, it can throw off your thyroid a little bit. So thyroid related, GLP related hair loss, all of these can be treated with Keralase, but you should also optimize your other factors. Okay, so another question I just got was, can Keralase be used with minoxidil? So Keralase can be used with minoxidil. I personally use Keralase with minoxidil. I use oral minoxidil, half a tablet daily, and it's really helped with my androgenetic alopecia. But when I go through my periods of stress mediated hair loss, or if I just feel like I'm shedding, I'll do a couple cycles of Keralase. So they are synergistic and they work together. Another question I just got was how many treatments of Keralase are needed? So we have shown the science shows that approximately 5 to 6 treatments are optimal, but most people start to see a difference after treatment 2 or 3. So we like you to not just do it episodically, do it in that entire package to turn back on your hair follicles, turn back on those growth factors. Okay. Um, Great. And then in terms of cost on an annual basis, if you are going to do Keralase annually, which some of us do need to do Keralase annually, you're looking at about $3,000 to $3,400. Sometimes we have specials at Tareen Dermatology, and we'll talk about some specials after. But you're looking at about $3,000, $3,500, which I think is pretty inexpensive given that you're turning back on your own follicles. You're not getting a hair transplant that then can fall out. Many people don't know if you do get a hair transplant, you actually need to keep getting hair transplants. So one hair transplant is not one and done. You will keep shedding. Your dihydroxytestosterone will continue to cause miniaturization of those hair follicles. So you do have to keep going back anywhere between every 5 to 10 years to get just a little touch up of your hair transplant. And these days, hair transplants cost between $6 to at the lowest to about $10 or $20 per graft, and you're doing 1,000 to 3,000 grafts. So you can do the math there. So I think that Keralase is really a really nice natural way to turn back on your stem cells, bring back that youthful hair follicle, and can do it very economically in some ways. Great. I think that those are all the questions that we got. Let's see. Oh, okay. There's a couple more. What does post-treatment look like? So I will often do Keralase at the beginning of my day whenever my staff have time to fit me in. Your hair is just a little bit wet after. The micro holes that are put in via the laser are very minuscule. So it's not like any of your friends or family will see little holes in your head. So the micro holes are put in with the laser, and then the KeraFactor is applied. Those are the stem cells. So your hair is just a little bit wet. So we have you at Tareen Dermatology. We really believe in low level light in addition to Keralase. Low level light turns back on the hair follicles as well. So you'll sit under a low level light. Your hair will dry. It might be a little bit frizzy like mine, but you're totally fine. You can blow dry after. We ask ideally, we don't want that KeraFactor to be washed away. So if you could ideally not work out that day, so the KeraFactor can sit in your hair anywhere between 12 to 24 hours, you get the most bang for your buck. What are the statistics of success? Excellent question. So it's very individual. Unlike PRP, Keralase does tend to have a little bit more success because you're using exogenous growth factor. So it's made in the laboratory, so it's made to turn things on. When you're doing PRP, which is platelet-rich plasma, you're using your own blood. And if you have a thyroid problem, if you're older, if you have iron deficiency anemia, you don't have all the things to turn back on your follicles. So Keralase does have a higher level of success in most studies than PRP, especially depending upon the substrate of yourself. But in terms of it's all or none. Some people will get a lot of regrowth, some people will get no regrowth, and a few people will get just a little bit of moderate regrowth. So the statistics do vary, but we do see at Tareen Dermatology that 70 to 80% of people will experience kind of that very good or at least good plus hair regrowth. 5 to 10% will get moderate regrowth, and about 10% will get very little. And for those people who are getting very little, that's why you all come to me. We'll switch you to PRP or another modality at that point. So we won't just take your money and say, hey, you're out of luck. So that's why we see you at least every 2 to 4 weeks while you're on the Keralase treatment, and we make sure you're getting better. Are there any side effects? Excellent question. There are very few side effects with Keralase because the micro holes that are made with the laser are minuscule, so there's very low risk of infection. The KeraFactor is hypoallergenic, so I've never seen anyone, even with the most sensitive scalp, psoriasis, eczema, get an allergic reaction to it. So other than, that it's a little bit sensitive, I would rate it about a 1 to 2 out of 10. in terms of pain. There's no other side effects than I can tell you from having it myself. So how does it compare to PRP? How does Keralase compare to PRP? So I've had both, and Keralase is not a million, not a billion, but a trillion times more comfortable than PRP. PRP requires, hundreds of needle pokes, and PRP, in order to be acidic, it has to be at a slightly different pH than our normal scalp. So it definitely can burn a little bit. Keralase is very comfortable. We at Tareen Dermatology use a cold Zimmer to help with a little bit of discomfort with the heat of the laser. So it's almost like nothing. There are videos of me falling asleep getting my Keralase. So it's a game changer compared to PRP. Okay, next question. Can you get your hair colored after the treatment, or can you get the treatment if you already do have colored hair? Excellent question. So in terms of hair coloring, as a dermatologist, I would wait at least 72 to 96 hours after Keralase to get hair coloring. The reason why is, again, you've got those micro little holes in your scalp to accept the Keralase, and your body can uptake the pigment and the allergens a little bit more. So you don't want to get primed and then get an allergic reaction to your hair dye and then never be able to get hair dye again. That would be tragic. So wait at least 72 to 96 hours after those holes have completely shut. And you can get hair dye before Keralase. Again, I would wait at least, 72 to 96 hours beforehand, because as we all know, when we get our hair dyed, sometimes they can give you a little burn, a little erosion. So you don't want to cause more Keralase or deeper laser penetration in that area. So again, you kind of just want to, if you're going to do anything, wait a little bit before and after your Keralase so you get your most bang for your buck. How much time between each treatment? One person asked. So anywhere between 2 to 4 weeks. We have found at Tareen Dermatology, from doing Keralase for several years, that if you wait a little bit longer between treatments, you actually see a little bit more regrowth, and thus then you can target the laser more to where the person is not getting as much regrowth. So initially, when we first started doing Keralase, 4 or 5 years ago, we would do it every 2 weeks, but now I space it out at least every 3 to 4 weeks, ideally, so we can see where the patient needs it. Awesome. How long does an individual session take? So the session itself, we ask you to block anywhere between 45 minutes to an hour. The laser itself takes about 10 to 15 minutes, and the application of the Keralase, the growth factor, takes about 5 to 10 minutes. And then just to reiterate, then we put you complimentary under some extra LED light, and that helps turn on the growth factor even more. So I would bank anywhere between 45 to 60 minutes, but you're not getting the treatment the entire time. You're kind of relaxing during the last part of it. Awesome. So I'm not seeing any other questions. Please respond with the keyword GROW, GROW, to the text following this event so that we can send out all of our specials to you. Thank you so much for joining. And I'm here for you, and I really believe in the treatment. I wouldn't talk about a treatment that I have not personally undergone, that I have not done on my own husband, who is the biggest baby of them all. So I really like this treatment, and I think it's quite beneficial, and it's safe, and it can be used synergistically with all the other hair loss things. And we are all living longer, and we want to keep our hair longer. Have a nice night, everyone. Thank you.